This segment is sponsored by GBMC Healthcare.
Thinking through your healthcare wishes and documenting them in advance is one of the most important things that you can do, not only for yourself, but for your loved ones. Joining us now is integrative and palliative medicine nurse practitioner at Gilchrist, Mary Underdong. Mary, welcome to the show today.
Good morning. Thanks for having me.
All right, so what are advance directives and when should someone make one?
That's a great question. So broadly speaking, an advance directive is a legal document that outlines future wishes for your medical care. They're really appropriate for any adult to make, regardless of if you have a chronic or terminal disease or not. What's really important to know is that they're documents for the future. Oftentimes, we don't think about getting sick. We don't think about becoming terminally ill. And that's why they're so important, is because it really helps to alleviate some of the stress and burden from your loved ones who ultimately will be making decisions for you.
Okay, good to know. Now, how are advance directives different than living wills?
So in general, an advance directive contains a living will. So an advance directive often contains two parts. The first part is what we call a healthcare power of attorney or a healthcare agent. That's the person who you would like to speak for you in the event that you're unable to speak for yourself. The second part of the advance directive is what we call the living will. And that outlines wishes as far as life-sustaining measures, things like CPR, intubation, feeding tubes, or being put on the dialysis machine.
Okay, that's good to know too. Okay, so who should someone choose as their healthcare agent?
So typically, a person chooses somebody who they trust to act on their behalf. That's oftentimes a spouse or a child or a sibling. One important thing to know is if you're going to choose a child, don't collectively choose all of your children together. It's really important just to choose one person to act as your primary power of attorney, and then you can choose multiple backup agents.
Okay, now how much decision-making power should someone give their healthcare agent?
There's a block on your advance directive that you can check or not, giving your healthcare power of attorney flexibility to make decisions on your behalf. I always recommend that patients check this block, giving their healthcare agent flexibility. Ultimately, this person knows you the best. They know your values. They know what's important to you. So theoretically, they should be able to make decisions that are in conjunction with the medical team's guidance that are aligned with your values.
Interesting. Okay. Now, does having an advance directive affect the quality of the health care that one person would receive?
So theoretically, having an advance directive would actually make your healthcare better because your medical team acts in a way that's most respectful of the things that are important to you. I think this was really something important that we learned during COVID when folks didn't have advance directives and, had to be really aggressive with their care when perhaps that wasn't what they wanted for themselves. So an advance directive really outlines the set of values and beliefs that are important to you.
Okay. So where can our viewers go for more information?
So, of course, you can go to the GBMC website. I also like the Office of the Maryland Attorney General. They have a advance directive. I also like the 5 wishes document, and you can search any of those in Google.
Perfect. Thank you so much for joining us today, Mary. Thank you for the info.